If you're over 50 and struggling with stubborn fat that just won't budge, no matter how clean your keto, how consistent your 16/8 fasting, or how hard you try, the frustration is real. You've done everything right, yet the scale stalls, inflammation lingers, and your body feels like it's betraying you. Menopause hits, hormones shift, insulin resistance creeps in, low vitamin D drags you down, and suddenly the rules have changed mid-game. You're overwhelmed by endless advice, spinning your head, craving something simple, not another complicated protocol. Then you try ACV and it burns your stomach. Green tea makes you nauseous. Caffeine ruins your sleep, or joint pain stops you from moving at all. Deep down, you're scared of triggering reflux, gout, or old injuries, scared this is permanent, scared you've lost control. But here's the truth. You can still kick ass after 50. Yes, even at 60, 70, or 81. This video is made for you. I'll share 4 science-backed, dead simple tips, starting with just 1 or 2 to activate fat-burning pathways like PPAR, tailored for hormonal shifts, insulin resistance, low vitamin D, and joint pain. Safe alternatives included. No forcing ACV or caffeine if they don't work for you. No extreme overhauls, just practical steps to take back control, feel strong, and prove your body still listens. You deserve this. Stick around, hit subscribe, and turn on notifications. These tips could change everything. 1. Apple cider vinegar. Apple cider vinegar is the first one I want to talk about, and it matters for both men and women. If you're over 50, this isn't cute bonus advice. This is one of those small, repeatable habits that can change how your whole day runs. Start your morning with apple cider vinegar. Yes, I've said it before, but I'm repeating it because after 40, and especially after 50, fat doesn't come off the way it used to. Stored fat stops behaving like spare change your body spends easily. It starts behaving like a locked account. You can be doing the same workouts, eating pretty clean, and still feel like nothing moves. A big part of that comes down to fat mobilization, your body's ability to unlock stored fatty acids and actually release them to be used as fuel. One pathway that's often discussed here is PPAR. Think of PPAR like a metabolic switch that helps signal fat to get out of storage and into circulation, where it can be burned. Apple cider vinegar, specifically the acetic acid, is often described as a signal that can support that switch. And when that switch is downregulated, the result is painfully familiar. You look at your body and think, why did this used to burn off so fast and now it just sits here? Exactly. That's the over 40 reality for a lot of people. So here's the move. Take about 1 to 2 tablespoons in the morning, ideally with or before a meal. Don't turn it into a personality trait. You don't need to carry it around all day like you're on some vinegar mission, but you do need consistency, because that little daily signal can make a real difference in getting fat to mobilize instead of just hanging out in storage. Now, there's another angle that matters even more once life gets busy and movement naturally drops. People often talk about uncoupling proteins, especially UCP2, in the context of energy expenditure. The simple way to understand it is this. Uncoupling proteins are sometimes described like a heat radiator in your body. Energy runs through the system, and more of it can be released as heat instead of being efficiently stored. In plain language, it's a way your body may waste a bit more energy, which sounds pretty good when you're not moving like you did in your 20s. And let's be honest, after 40 and 50, careers peak, responsibilities stack, stress climbs, and a lot of people become more sedentary without even noticing it. That means your baseline burn drops, and your margin for error gets smaller. So if you can nudge your system to burn a little more at rest while you work on movement, that's leverage you should take seriously. There are other pathways people bring up here too, things like AMPK and appetite signals, but I'm not going to drown you in lab vocabulary. Here's the urgent point. If you're over 50, you don't have the luxury of waiting for motivation or hoping it magically gets easier. You need small actions that you can repeat, that compound, that set your metabolism up to work with you instead of fighting you. Apple cider vinegar is one of those actions. Now let's move into the next one. 2. Green tea. Now let's talk about green tea because this one is not fluff. and it becomes even more important once you're over 50. Here's what I want you to do. Have your 1 or 2 cups of coffee in the morning, like normal. Then once that's done, switch over to green tea for the rest of the day. This isn't about being fancy. This is about sending the right signals to your metabolism for longer, without relying on more coffee. Green tea is often described as a strong phosphodiesterase inhibitor. The simple way to say that is it helps keep a signal called CAMP elevated. And CAMP works like a metabolic switch. When that switch is low, your body leans towards storing. When that switch stays higher, your body is more willing to mobilize stored fat and use it as fuel. Coffee can help with this, but green tea tends to support it more gently and more consistently through the day. And then there's the other major reason green tea shows up in fat loss conversations so often. It contains EGCG, epigallocatechin 3 gallate. You've seen that word everywhere, but here's what matters. EGCG is often discussed for its role in slowing the breakdown of catecholamines, the same stress hormones and fat-burning messengers like epinephrine that rise during intermittent fasting and ketogenic dieting. A huge part of why fasting and low-carb approaches work is because these signals go up, and they tell your body, we need fuel, start pulling from storage. The problem is, your body also has a braking system. It doesn't want adrenaline and epinephrine running high forever, so it breaks them down. One of the enzymes involved is catechol O methyltransferase, COMT. Think of COMT like the guard at the door saying, time's up, we're shutting this down. What EGCG may do is help slow that braking system so the fat-mobilizing signals can last a bit longer instead of fading out too quickly. And this is exactly why I bring it up for people over 50. You might still train hard, and I love that if you do, but most people are not moving like they did at 20. Life changes, bodies change, recovery changes. So if we can keep those fat-mobilizing signals active a little longer, you get more benefit at rest, not just during your workout. That is the win. That is the leverage. 3. Vitamin D. Vitamin D is not a nice to have. If you're over 50 and fat loss has slowed to a crawl, vitamin D is one of the first things you need to take seriously because it sits upstream of the problem you're really fighting, and that is blood sugar control. When vitamin D is low, the body often handles glucose worse. And when glucose control gets messy, fat loss gets punished. Hard. Here's the point the transcript is making, and you need to hear it clearly. A study mentioned in clinical diabetes looked at 152 patients and found a high overlap between vitamin D deficiency and insulin resistance. Then, after vitamin D was given, the insulin resistance numbers dropped sharply. Now, I'm not calling vitamin D a miracle, but I am calling it a glaring red flag. If you're over 50, stuck, inflamed, craving carbs, or feeling like your waistline is glued in place, you cannot ignore vitamin D status and expect metabolism to cooperate. Because after 50, unstable blood sugar doesn't just make you tired. It drives inflammation, it amplifies stress signaling, it pushes your body into what I call storage mode, where fat becomes insurance, not fuel. The transcript also brings up glycation, the process where excess sugar binds to proteins and creates more metabolic stress. That's not just a fancy term. It's a real drain on your system. It pulls energy and resources away from fat mobilization and forces the body to prioritize damage control. And when your body is busy fighting damage, it is not interested in shedding weight. Now let's talk logistics, because this is where most people get fooled. You think you can just get more sun and you're fine. Past 50, your skin does not produce vitamin D from sunlight the way it used to. The conversion from UVB exposure into usable vitamin D becomes less efficient as skin changes with age. So the same amount of sun that worked at 25 can be basically underwhelming at 55. That's why food and supplementation enter the conversation. The transcript strongly recommends whole food vitamin D sources first, especially marine foods like canned sardines, anchovies, and oysters. Yes, skin on and bone in, not because it's fun, but because those nutrient-dense parts matter. And if you can't do those foods consistently, then you need to be honest with yourself and consider supplementation based on your situation and what your healthcare provider recommends. 4. Protein and omega-3. Protein is where I want to go next, because for people over 50, this is not a minor detail. This is one of the main reasons your body either stays strong and lean, or slowly slides into that soft, tired, harder to recover place that so many people accept as normal aging. It's not inevitable, but you do have to treat protein differently now. There are two things the original message is trying to drill into you. First, you want your protein sources to be higher in omega-3, which is why you keep hearing phrases like grass-fed and grass-finished. Second, once you're older, you typically need more protein, not less. A lot of people do the opposite. They eat less protein as they age, and then they wonder why their strength drops, their metabolism slows, and their body composition changes even if their calories don't look that different. Now let's talk numbers in a simple, practical way. The standard RDA for protein is about zero point 0.8 grams per kilogram of body weight. You don't have to treat that as a rigid rule, but it gives you a clear direction. Over 50, you usually don't want to undershoot protein. You want a deliberate increase. The transcript frames it as roughly a 25 to 30% bump, and the reason is straightforward. With age, the risk of sarcopenia goes up. That is the gradual loss of muscle and strength, and it's driven by a mix of biology, inflammation, and often less daily movement. Protein helps protect you from that by supporting a more positive nitrogen balance and giving your muscles the raw materials they need to stay alive and responsive. Protein also matters because of its thermic effect. It costs your body energy to digest and process protein, so it can increase daily burn a bit. The key idea is that swapping some carbs or fats for more protein can help your metabolism feel less sleepy, especially at rest. And there's another benefit that people feel immediately in real life. More protein tends to mean more satiety. Now let's address the omega-3 piece, because that's the second half of this section. And omega-6 heavy patterns are frequently discussed in the context of inflammation and water retention. When inflammation is higher, people often feel puffier, more achy, and more stuck. That's why the recommendation leans toward protein sources that are less likely to come from animals fed a heavy soy and corn diet, and more likely to come from grass-fed, grass-finished systems. After a workout, you don't just want to consume protein. You want your body to actually use it to rebuild muscle. Omega-3 intake is often discussed as one factor that may help the body respond better to that protein, which means you may get more benefit from the same effort. 5. Vitamin C. Okay, let me jump back to something I have been paying more attention to lately, and that is vitamin C, specifically the idea of taking a bit more of it as we get older. Here is why this matters. As you age, your immune system naturally does not run as strong as it used to. Yes, vitamin C helps immunity. Everyone knows that. But a lot of people do not realize vitamin C also plays a big role in something called the carnitine pathway, which is basically one of the ways your body helps move fat into the cell so it can be burned for energy. So if you are low in vitamin C, you may literally be making fat burning harder than it needs to be. You just do not oxidize as much fat. There is a study in the Journal of the American College of Nutrition that found people with adequate vitamin C had about a 30% higher fat oxidation rate compared to people who were low. That is a big gap. And what is interesting is vitamin C deficiency can happen faster than you think, because vitamin C is water soluble, meaning you do not really store much of it. And here is the part that hits harder after 50. A lot of you notice you urinate more as you get older, right? That means you can lose minerals, and you can also lose water-soluble vitamins more easily. So you might take some vitamin C from food or a supplement, your levels go up, but they can come right back down again. Now, the cool thing is when vitamin C intake is higher, it may also help with cortisol regulation. And cortisol is one of those hormones that can quietly push your body toward fat storage, especially around the midsection. So supporting vitamin C can help reduce some of that cortisol-driven fat accumulation effect. That is why, in practice, I like the idea of getting vitamin C consistently throughout the day, not just one random dose and then forgetting about it. Because what we are trying to support at this stage of life is exactly what gets harder. The mobilization of fatty acids, getting fat to actually move and be used. Vitamin C becomes a really practical tool as you get older. Personally, I do not push mega vitamin C for younger people. Younger bodies usually benefit from letting the immune system train a bit, that hormetic effect where it learns to handle stress and adapt. But after 50, you do not always have the luxury of that. You often need more support for immunity and for that carnitine pathway that helps fat get burned efficiently. 6. Intermittent fasting. Let's slow this down and go deeper, because intermittent fasting after 50 is not about copying what worked for you at 30. It's about understanding how your biology has shifted and working with it instead of against it. When you were younger, your metabolism had more room for error. You could skip a meal, eat late, or train hard on low sleep, and your body would bounce back easily. After 50, that elasticity narrows. Hormones like insulin, cortisol, and growth hormone behave differently. Muscle recovery takes longer. Energy fluctuates. That's why the same fasting routine that made you feel powerful at 35 might make you feel drained now. But if you adjust the rhythm, the timing, intensity, and recovery, you can turn fasting into one of the most strategic fat-burning and longevity tools available. Here's how I want you to think about it. Fasting is not starvation, it's precision timing. When done right, it tells your body, let's clean house, let's switch fuel sources, let's rest the digestive system so energy can go into repair. The transcript explains this well. During fasting, your body begins converting stored fat into fuel, but once you pass that 16-hour mark, especially around 18 to 20 hours, something deeper starts to happen. Your body activates genetic pathways, such as the MIR133A pathway, that encourage the conversion of white fat, the stubborn, soft kind that sits around the waist, into a more metabolically active form of fat that's easier to burn. Think of it as reorganizing your fuel tanks, moving fat from deep storage into ready to use. That's why extending your fast just a bit longer can make a visible difference for people over 50. You're not just eating less, you're teaching your body to access fat that's been locked away for years. It's not about pushing harder, it's about unlocking smarter. Now, I know what you might be thinking. Won't fasting longer make me lose muscle or slow down my metabolism? Not if you approach it correctly. After 50, muscle preservation is non-negotiable. But fasting doesn't mean muscle loss if you feed strategically during your eating window. What you're doing is cycling between stress and recovery, brief metabolic stress during the fast, followed by nourishment and repair when you eat. That contrast is what keeps metabolism flexible. Here's what that looks like in real life. You wake up, stay hydrated, maybe have black coffee or green tea. You do light movement in the morning, stretching, walking, or mobility work. As you approach hour 18 or 20 of your fast, that's when you do your workout. It doesn't need to be extreme. A 30-minute strength session, body weight training, or brisk walk is enough. Then you break your fast with a protein-rich, nutrient-dense meal. That timing makes your body more responsive to nutrients. You get better absorption, better muscle repair, and better hormonal signaling. I hope these tips gave you clarity and a real starting point. After 50, this isn't about perfection or punishing workouts. It's about smarter timing, better signals, and habits you can repeat, so your body stops resisting and starts responding again. You don't need a dozen extreme routines. You need a few core moves done consistently, and that's exactly what we covered today. If this video helped you, please hit like. It tells YouTube to share this with more people who are struggling quietly. Share it with someone who keeps saying, nothing works after 50, because one small change can become a turning point. And subscribe to Senior Health Guard with notifications on, so you don't miss the next practical, science-based strategy. Now I want to hear from you. Comment 2 things, your age and the one issue hitting you hardest right now. Stubborn belly fat, menopause weight gain, cravings at night. Be specific. I read these, and your comments shape what I create next. Next video on Senior Health Guard, I'll break down a simple weekly plan to make fasting easier after 50, plus the biggest mistakes that stall results, and how to adjust if you deal with reflux, blood sugar crashes, or nighttime bathroom trips.